everyone, my name is Alexia and with me today is Dr. Ernestine Watson. Today we'll be talking about sickle cell disease, giving you a little background information on it, complications of the disease, preventative measures, and myths around the disease. So, first things first, sickle cell disease, what is it? It's basically a red blood cell disease that occurs due to a change in one of your hemoglobin molecules. This change causes your red blood cell to take a different shape, known as a crescent shape or a sickle shape. With this new change in the red blood cell, it causes early destruction of the red blood cells and hence decreases your total red blood cell count.
What we really want to let our patients and persons know is that this disease you can live well with this disease. There are ways to prevent patients getting into a crisis, and the usual things that may happen to a patient is that they may suffer from anemia or they may have pain crisis as a result of the occlusion. Now, the drug, there's a drug, hydroxyurea, which most of our patients would know. That drug prevents the crisis from happening. And hydroxyurea, it's an old drug. Most persons know about the drug. However, the compliance is a little bit low. So what happens is that persons may not want to take the drug. There's a new drug that has been approved by the FDA in 2019, voxelotor. Now that drug also helps to improve the red blood cells and to prevent and to cause the hemoglobin levels to be increased. So patients who would take that drug, they are able to deal with the anemia which is associated with the sickle cell disease. There's also the L-glutamine, another drug which is over the counter and which helps to prevent the patient from getting into crisis. So those are the preventative measures as well as how we can treat. To treat the anemia, other than having the drug therapy, which was recently discovered, we would have to do blood transfusions, which in itself has many complications and which patients don't, the doctors don't like to use that as a first choice.
Right, thank you, Dr. Watson. So let's look into the pain management of it. Now, there's an acute setting for the pain and a chronic setting. For an acute setting, such as your crisis, we never want to wait too long to start therapy. Now, I always recommend hydrating. It's very important to reduce the pain that you may be associated with the crisis. I would also recommend that if it's a mild to moderate pain, you can have your acetaminophen with an opioid, such as codeine. I would say, go to your NSAIDs like ibuprofen. And if this isn't working, then please do not hesitate to seek medical attention. It is very important. For the chronic pain, opioids, again, are very good in controlling pain. The doctor may choose to put you on a long-acting opioid, something that you don't have to take every day per se, such as fentanyl. It comes as a patch that you apply every 3 days. Now, if it's a case where you're having some amount of breakthrough pain while on your therapy, then the doctor may choose to give you an immediate release opioid, something that will work a little quicker to give you that pain relief. Sadly, the thing with sickle cell disease, because of the amount of pain a patient may experience, this may put them into depression. But we have another class of medication on the market, such as tricyclic antidepressants, that gives you a dual effect. It helps with pain associated with the disease and as well as to treat the depression of the disease.
And one thing I want to say to our patients is that the National Health Fund, they cover quite a number of the drugs, the hydroxyurea and the pain. Of course, the newly registered drugs, they are not covered by the NHF.
Right. Okay, so now we're going to debunk some of the myths surrounding sickle cell disease. And with us today, we have our pharmacy intern, Venicia Henry. So Venicia, what myths have you heard about the disease?
Well, Alexia, I've heard a number of them. So the first one I heard is that pethidine actually controls pain more than morphine when a patient is experiencing a painful crisis.
Okay, I'm happy that you brought that one up because that's not necessarily true. Morphine actually gives you a better pain control than pethidine. I think where the misconception lies is that some patients tend to want pethidine because sadly of a high that they get from it. And with that, they tend to want to get it more. But that's not necessarily the case.
I also heard of another one where a customer came in and they were worried about taking a cold shower because they heard that a cold shower can actually trigger this painful crisis.
Again, not entirely true. A sickle cell disease patient can experience pain in cold temperatures, but it's in the extreme cases. A cold shower should not trigger a crisis.
All right. So the last theory that I heard is actually from a mother that came in with their child, and the mother was worried that their child will not be able to live adulthood because of this disease.
I can understand where she may have heard that from, because prior to the 1990s, there wasn't much screening being done, and for that reason, children were living into adulthood. But as of now, or as recently, our government has done a very, very good job with screening. So with early screening leads to early diagnosis. And with that, we can prevent the complications such as stroke or future infections.
Oh, that was such an eye-opener. Thank you, Alexia.
My pleasure, anytime.